In the last 15 days, more than 28,000 people over 65 received a dementia diagnosis in the United States alone, one every 66 seconds. And for many of them, the cause was never their age, their genetics, or fate. It was a medication sitting on the bathroom shelf, a medication a doctor prescribed, a pharmacy filled, and nobody ever said could be slowly shutting down their memory. Today, you're going to learn about the 6 most common medications linked to accelerated memory loss. And number 1 will surprise you, because millions of people take it every single day without the slightest idea of what it is doing to their brain. What you're about to hear in this video is not opinion or speculation. Every medication we're going to review has been studied in research published in journals like JAMA Neurology, the British Medical Journal, and Frontiers in Aging Neuroscience. These are institutions that demand the highest level of scientific evidence before publishing any finding. Anticholinergic medications, a term you're going to hear several times today, have been under scrutiny from the medical community for years. They work by blocking a substance called acetylcholine, which is the chemical messenger your brain needs to form new memories, stay alert, and think clearly. The problem is that after age 50, the body produces less acetylcholine, so any medication that blocks it hits a 70-year-old brain far harder than a 30-year-old one. We're going to count down from number 6 to number 1. But stay until the end, because the number 1 medication is not a single pill. It is something far more dangerous that almost no doctor explains to their patients. And it could be happening to you right now without your knowledge. Medication number 6, diphenhydramine, Benadryl. There's a little pink pill sitting in almost every medicine cabinet in the world. It is called diphenhydramine, but you know it as Benadryl. People reach for it to fall asleep, to calm an allergy, to take the edge off a cold. It costs a few dollars, it sits on an open shelf, and most people assume that because nobody needs a prescription for it, it must be gentle. But inside your brain, that pill is doing something very different from what the box says. Benadryl belongs to a group of drugs called anticholinergics. That means it blocks acetylcholine, the substance your brain uses to create new memories and keep you focused throughout the day. As we age, the brain produces less acetylcholine and depends more heavily on every molecule it has left. So a drug that blocks it lands far harder on a brain at 65 or 70 than on a young one. The area that takes the hit is the hippocampus, the small seahorse-shaped structure where new memories are formed before they get filed away. A paper published in 2023 in the Journal of Geriatric Cognitive Health followed older adults who used anticholinergic drugs regularly over several years. The result was a 54% higher risk of developing dementia compared with people who stayed off them. More than half again the normal risk from something most of us treat like candy. What makes it even more alarming is that many people take this substance without knowing it because it hides inside any product labeled PM, nighttime, or allergy relief. If you need something for allergies, newer antihistamines like loratadine do not cross into the brain the way Benadryl does and are far safer for the long haul. But the first step is to read the label on everything you take before bed. And the next medication on this list is one your stomach loves, but your brain quietly pays for. Medication number 5, proton pump inhibitors, omeprazole/Nexium. If you have ever dealt with heartburn, reflux, or that burning feeling after meals, you probably know omeprazole, sold as Prilosec, or esomeprazole, sold as Nexium. They are among the most prescribed medications in the world. They shut down acid production in the stomach, and the relief is so quick that people stay on them for years, sometimes decades. The moment they stop, symptoms come roaring back, so it feels like the pill is the only thing holding the line. But there's something almost nobody hears at the pharmacy counter. Your stomach needs acid to pull certain nutrients from your food. The most important of them is vitamin B12, which protects the wiring of your nerves and your brain. Turn the acid down far enough for long enough, and your B12 quietly drops. So do magnesium and calcium, 2 minerals your brain cells depend on to fire and signal cleanly. When neurons do not receive those nutrients, You get misfires, confusion, and memory slips that look exactly like early Alzheimer's when the real cause is a nutrient your medication has been blocking all along. In 2016, a large study published in JAMA Neurology examined more than 73,000 people aged 75 and older. Regular PPI users had a 44% higher risk of dementia than people who did not take them. And the trouble runs deeper than nutrients, because these medications have also been shown to raise levels of a protein called amyloid beta in the brain, which is exactly the sticky protein that builds up in Alzheimer's disease. If you take one of these every single day, that is the conversation to have with your doctor. Many people can taper down onto a gentler class called H2 blockers, like famotidine, which is far less likely to affect your thinking. The goal is the lowest dose for the shortest time, not a pill you take forever out of habit. But the next medication is prescribed for a problem most people would rather not talk about. Medication number 4, Oxybutynin ditropan. This medication is called Oxybutynin, and it is sold as ditropan. It is given to seniors who deal with a sudden, urgent need to get to the bathroom, the kind of overactive bladder that can reshape an entire day. The relief it provides is real, and the embarrassment it spares people is real too. But Oxybutynin works by blocking acetylcholine, the same memory chemical Benadryl blocks. And this one slips across into the brain very easily and parks itself right where memories are made. That makes it one of the more dangerous ones on this list for an older adult, especially when taken month after month, year after year. In 2019, the British Medical Journal published a study of people over 65 who took strong anticholinergic drugs like Oxybutynin for more than a year. Their risk of dementia was 49% higher, close to 1 in 2. And what troubles me most is that almost none of them were warned. They were told a pill would calm the bladder. Nobody mentioned it might be dimming the mind at the same time. The fog gets blamed on age. People describe forgetting appointments, losing their keys 10 times a day, dropping the thread of a simple conversation. And everyone around them nods and says you're getting older. It is rarely traced back to the prescription until real ground has already been lost. If you take Oxybutynin and you have noticed your memory slipping, take that seriously. You do not have to choose between your bladder and your brain. Newer drugs like mirabegron, sold as Myrbetriq, work through a completely different pathway and do not block acetylcholine at all. For most older adults, they provide the same control with far less risk to thinking. But the next medication might be the most surprising of all, because at first it feels like a rescue. Medication number 3, Benzodiazepines, Ativan, Valium, Xanax, lorazepam, diazepam, alprazolam. You know them as Ativan, Valium, and Xanax. They're among the most commonly prescribed drugs in the world for anxiety and sleep problems. They work by boosting GABA, the brain's natural calming signal that turns down an overactive nervous system. At first, they can feel like a lifeline. The panic eases, the racing thoughts slow down, sleep finally comes. But over time, the picture begins to change. A 2022 study published in the British Medical Journal followed more than 8,000 seniors for 6 years and found that those who used benzodiazepines for longer than 3 months had a 51% higher risk of developing Alzheimer's disease. The longer-acting medications, such as diazepam, appear to be even more problematic because they remain in the body longer and accumulate in fatty tissues, including the brain. What these medications create is a slow chemical sedation of the entire brain. Learning becomes slower, mental flexibility decreases. Many people describe a sense of emotional flatness, as if they're moving through a fog and no longer feel entirely like themselves. The cruelest part is the exit. If a benzodiazepine is stopped abruptly, anxiety and insomnia often return with even greater intensity, accompanied by agitation that can become genuinely dangerous. That makes the medication feel indispensable at precisely the moment it may be causing the greatest harm. So here's the rule, and it matters. If you have been taking a benzodiazepine for more than a few weeks, do not stop suddenly, because doing so can be life-threatening. Work closely with your doctor to taper the medication gradually over weeks or even months. There are gentler alternatives. Buspirone, for example, can help with anxiety without causing sedation or mental clouding. There are also specialized forms of talk therapy designed for insomnia and anxiety that can restore calm without the cognitive cost. But the one coming next carries one of the heaviest hidden burdens on this entire list. Medication number 2, Amitriptyline, Elavil. This is an older antidepressant that is still widely prescribed today for 3 different problems: nerve pain, sleep difficulties, and migraine prevention. That versatility is exactly why it became so widespread. It looks like a medication that could do everything. But beneath the surface, amitriptyline is one of the most powerful anticholinergic drugs still in common use. That means it blocks acetylcholine so aggressively that with long-term use, memory problems stop being a rare side effect and begin to resemble an expected outcome. In 2015, a large study published in JAMA Internal Medicine followed more than 3,400 adults aged 65 and older over a decade. Those with the highest cumulative exposure to anticholinergic drugs, such as amitriptyline, had a 54% greater risk of developing dementia. And almost none of them were ever told that the medication could do that. They were given it for sleep or for pain, and gradually noticed words disappearing, memory becoming thinner, concentration weakening, and they simply assumed it was part of getting older. It does not even require a high dose. A small nightly dose taken for years can quietly erode cognitive function without any obvious warning signs until the loss becomes significant. If you or someone you love takes amitriptyline, that is a conversation worth having soon. For nerve pain, options such as duloxetine or gabapentin may provide similar relief without the same anticholinergic burden. For sleep, melatonin or a very low dose of doxepin, which is considerably gentler on this chemical pathway, may serve as alternatives. And for mood disorders, newer antidepressants such as sertraline or escitalopram are generally considered much safer for the long-term health of the brain. Now we arrive at number 1. And I warned you at the beginning, this is not what you expect. Medication number 1, anticholinergic polypharmacy. You were probably expecting one final pill, one last villain with a name and a label. But the reality is more subtle and far more dangerous. The greatest risk does not come from a single medication. It comes from the silent accumulation of multiple anticholinergic medications taken together while nobody calculates the total burden. This is called anticholinergic polypharmacy, and it may be one of the leading causes of medication-induced memory loss in older adults. Imagine a very common scenario. A senior takes Benadryl every night for sleep, Oxybutynin every day for bladder control, and amitriptyline for nerve pain. Individually, each medication may produce only a small, barely noticeable effect. Together, however, those effects compound, and the burden on the brain rises rapidly. In 2022, a study published in Age and Aging tracked more than 280,000 older adults and found that those with the highest anticholinergic burden had a 120% higher risk of dementia within 10 years, more than double the risk. And the overwhelming majority had no idea they were taking anticholinergic medications at all. Nobody had ever explained it to them. When acetylcholine is blocked from several directions simultaneously, the brain does not simply slow down. Neurons can begin to weaken from underuse, connections may shrink, and the brain can settle into a quiet, underpowered state that looks remarkably similar to Alzheimer's disease during cognitive testing. Now I want you to see the full picture, because when you review these 6 medications together, a pattern emerges that most people never see on their own. Think about what we just covered. Benadryl blocks acetylcholine so you can sleep. Oxybutynin blocks acetylcholine so your bladder calms down. Amitriptyline blocks acetylcholine to relieve nerve pain. 3 different medications, 3 completely different reasons for taking them, and yet all 3 attack the exact same chemical inside your brain. Now add the proton pump inhibitors that steal your vitamin B12 to fuel your neurons need to function. Add the benzodiazepines that sedate your entire brain and flatten your ability to learn and remember. And add paroxetine, which presents itself as a modern antidepressant but carries the same anticholinergic activity as the oldest medications on this list. When you lay all of that on the table, what you see is not a coincidence. It is a medical system that treats each symptom separately without considering the cumulative effect on the most important organ in your body. And that is what makes anticholinergic polypharmacy so devastating. It is not that one doctor harmed you on purpose. It is that each specialist prescribed the best option they had for their area without anyone sitting down to add up the total cost to your brain. The cardiologist does not talk to the urologist. The urologist does not talk to the neurologist. And meanwhile, the acetylcholine in your brain is taking hits from 5 different directions without a single person in the chain raising a hand and saying enough. But there is something else I want you to understand before we close this video, and it is probably the most valuable thing you will hear me say today. The human brain after 50 is not fragile. It is adaptable. For decades, we were sold the idea that after a certain age, mental decline was inevitable, that neurons only die and never recover. That is not what current science shows. The brain retains the ability to form new connections, to strengthen existing ones, and to compensate for damage, as long as it is given the conditions to do so. This is called neuroplasticity, and it does not disappear at 60 or 70 or 80. What does slow it down is constant exposure to substances that block the chemical messengers it needs to function. It is like trying to build a house while someone takes the bricks out of your hands. It does not matter how much willpower you have, or how many crossword puzzles you do, or how many books you read. If the chemical your brain needs to record a memory is being blocked by 3 different pills every night, the battle is lost before it begins. The good news is that when those barriers are removed, when the anticholinergic burden is reduced under medical supervision, many older adults experience improvements they never thought possible. They recover names they had forgotten. They follow conversations again without losing the thread. They feel more present, more awake, more like themselves. Not every case is reversible, and I am not promising miracles. But I am telling you, with evidence behind it, that a careful review of your medications may be the most important step you take this year for the health of your brain. And that does not cost money. It costs one honest conversation with your doctor. But here is the hopeful part, and it is the reason I made this video. Medication-induced cognitive decline is often reversible when it is identified early. Reduce the burden, and many people regain clarity, energy, and memory within weeks or months. The brain is far more resilient than most people realize, but only when the source of harm is removed. The solution does not require a miracle. It requires a careful medication review. Sit down with your doctor or pharmacist and review every prescription medication, every over-the-counter product, and every supplement you take. Add up the total anticholinergic burden. Simple scoring tools are available to help identify that risk. You do not need to make drastic changes today, but you do need to have this conversation with your doctor this week. That simple step can be the difference between losing mental clarity year after year or getting it back. If this video helped you understand something you did not know before, share it with someone who needs to hear it. And if you want to keep learning how to protect your brain, your strength, and your quality of life after 50, you'll find more evidence-based content right here.